Kenrick Thomas. He's the communications and event manager at Bread for the City in Washington, D.C. Their mission is to help low-income people with food, clothing, and medical care. Kenrick, thank you so much for joining us. The first thing I want you to do is to tell us about the programs you offer to people.
Well, Bread for the City has been around since 1974 in Washington, D.C. And the great thing about our services is it's specifically for the low-income residents in Washington, D.C. We provide a plethora of services for them, such as food insecurity. So we have one of the largest food pantries in Washington, D.C. We provide clothing assistance. We also provide free medical care. We also provide free legal care as well, and we also provide social services. The reason why we offer a multitude of services is because our low-income population of Washington, D.C., they have multiple issues that need to always be straightened out. And a lot of the times it's not just food. A lot of the times it's not just clothes. It's not just having access to affordable health care. It's several things. And we want to have a one-stop shop where our community members can come to our nonprofit organization and to be able to knock out several instances in our buildings so that they don't have to spend money going around the city to be able to get our services. So our services specifically for the low-income community members in Washington, D.C., who are specifically a lot of the times are left out.
Well, that's great to hear, a one-stop shopping place where they can kind of get help in different areas. I wish all cities had that. But tell me, are you seeing more people than you had before the pandemic? And what kind of concerns are people coming to you with?
Yes, we're seeing a significant increase in the amount of people who are coming to our organization. Most of them are in need of food. Before the pandemic, we would probably distribute about 500 bags of groceries in a week. Now we're doing as close to 1,000 in one day. We've also had to make changes because of the pandemic. Before the pandemic, a lot of our community members were able to just come into our building at our Northwest Center or our Southeast Center and receive a bag of groceries. But because of the pandemic, we didn't want them to leave their homes and possibly risk getting COVID. So what we did was we created a delivery service where we're able to distribute the grocery bags and leave them on their front steps so that they're able to actually get the bag without a possibility of catching COVID-19. It's been really, really tough at Bread for the City because we're the ones that are on the front line, us and several other nonprofits in Washington, D.C. And we have people who are coming to our organization who's never needed our services before. We have now made some changes to the point where before you had to be within 200% of the federal poverty level to receive food from us. But now we've actually done away with that and opened it up to anyone because people who were middle class are now needing our services.
I was going to ask you, did you say you were originally, before the pandemic, giving away 500 bags a week, and now it's 1,000 a day?
Yes.
Is that what you said?
Yes. It's
That's
close to
unbelievable.
1,000. It
Who are these
fluctuates.
people?
Majority of
How do
them
people
are our
need
black
help?
and brown population. Yes, majority of them are our black and brown population. A lot of them is the minority community who are constantly always left out. And what happens is when you're working a job where you have to show up to get paid, so that can be a waiter or a waitress, that can be a bartender, a job where you don't have a salary and you're relying on a consistent income. You could be doing fine before the pandemic, but when the pandemic now takes place, now you can't work on a consistent basis. So now you're underemployed and you need money. And we're seeing an increase because of that. A lot of people who were able to live a comfortable lifestyle before the pandemic, and now because they're not going to work all the time, now they're in need of food and services. And that's where we came in. And it was a shift that we had to make because here at Bread for the City, we believe that we need to do whatever we need to do to be able to help those who are in need in Washington, D.C., and that's who we put first. So a lot of them are our black and brown community members, our Latinx community members, and also a huge Asian population as well who are in need because of the pandemic.
Yeah, these are our friends, neighbors, people we know, like you said, barbers and hair salons and places where people have had closures or COVID issues. How do you approach people, or is there a way if you think somebody may need help? What's the best way to help people by being respectful to them? Obviously, we know that people are sensitive and they may feel bad and they shouldn't, but is there a way to direct people, or if you think they may need assistance, but they don't know where to go or they don't want to talk about it. Is there a good way to help people and be sensitive with this discussion?
Absolutely. I think that's a very important question. At Bread for the City, dignity and respect is one of the biggest things that we pride ourselves on. We believe that even if you're low income, that you should have the same experience as anyone else. And so what we do is we have information on our website at breadforthecity.org where you can actually go on our website and fill out a form, and you're able to actually get groceries delivered to your door once a week by Bread for the City. And when we're talking about groceries, we're talking about groceries that are healthy. So food that are low in sodium, low in fat, healthy, fresh vegetables, because we don't want to give our community members unhealthy food, because low income can now turn into health issues as well when we give them unhealthy food. So we're giving them healthy food to make sure that they're getting the proper nutrition and that they're staying out of the doctor's office as well.
Well, Kenrick, thank you so much for giving us this information, and thank you for all you and your organization are doing for the people there in Washington, D.C. Take care. And are you one of the people who've been hearing no mask, no service when you try to go to restaurants?